Hello, I'm Dr. Marla Shapiro. I'm a former president of the North American Menopause Society, and today I'm joined by Dr. Lisa Larkin. Tell us who you are.
I'm a women's health internist in Cincinnati, Ohio. I'm founder of Ms. Medicine, and I'm currently on the board of trustees of NAMS.
So, for our women who are watching, perimenopause, menopause, midlife, in and around, the notion of the evolution towards virtual medicine. And I want to specifically think about this for our women. I'm your patient. When is it appropriate? When is it not appropriate? What are the pitfalls? What should I be thinking about? Do I even need to ever come in and see you?
Well, the first thing I would say to women who are watching is, this really is an exciting time in midlife women's health. We've made tremendous advances in medical care and in available therapy, but the other thing that's really happened is the awareness of menopause, and so we really know we haven't been doing an adequate job, and this is really an exciting time. And so I think the awareness that midlife women's health is important and a new beginning is really there. What's happened in the telemedicine space is a combination of what's happened with femtech, really interest in kind of this midlife women's health, but also COVID, which has really driven this adoption for everyone of telemedicine. What I would say for our consumers, though, is the problem with telemedicine and these virtual visits is it's not one size fits all, and that really consumers in every way, especially with social media, have to be a little bit cautious to make sure that they know what they're getting. And what I mean by that is virtual visits, if you have an established provider who knows you well, there are certainly many circumstances where that provider can provide care to you seamlessly, virtually. But that's not...
Yeah, there's another but. I mean, you can almost, go online and look for a virtual healthcare provider where there isn't the continuity.
Right. And that's what I would say, and that's where I get concerned. You
Yes.
and I get concerned as well, right? Which is providing healthcare in a vacuum. We would say is never good, right? The most important thing is to have a trusted, complete, established relationship with your provider who has all the data to be able to make informed decisions. And these individual telehealth virtual visits may be helpful, but they also can have potential pitfalls, right, of incomplete information about you. And then the other thing is inability to have longitudinal follow-up or to be able to refer you. And so I think the messaging for women is just a little bit of buyer beware. The single visit, virtual medicine visits, again, I think there's potential great advantages and potential concerns. The other category is really these companies where you can get a prescription for many things just by answering an online questionnaire, and a bot or a physician reviews the questionnaire and you can get sent prescriptions. That, in my opinion, is not telemedicine. That's e-commerce prescribing, and there's concerns about that for me.
To me, for women in general listening, I think one of the most important messages you're highlighting here is, just as if it wasn't virtual care, the notion of a continuity, longevity, someone who can quarterback for you, that notion doesn't change if it's virtual. But if it's an episodic, seeing this one, that one, it may actually really be quite harmful.
Right, and I think that really is exactly correct. I mean, again, and you and I both see patients longitudinally and have for a long period of time, and I think we both really believe in the value of knowing your patients well and that ability to follow up, right, and to be able to examine patients, right? Like, I believe that telehealth is here to stay, and it is one additional component to our offerings to take care of a patient. But when done in a vacuum, I would say consumers should just be cautious. Not that they can't get good things out of the educational experience, but again, I mean, I think having medication prescribed for you without the ability to have any follow-up is a concern, right? Because there's drug-drug interactions, or your symptoms or your situation changes, and I've seen where patients can't go back to the same physician and get care.
So if you had to give some basic, how-tos, some basic tips to keep forward of mind as a consumer looking to have a virtual relationship, what are some of the basics that you would say?
Well, so I think I would say that a 26-year-old or a 25-year-old, I would maybe give different guidance in some circumstances compared to our midlife women where we are, right? So, and we've been, learning all about the significant changes that happen at midlife, right, in terms of cardiovascular risk and breast cancer risk and all of these things that we're worried about. At midlife, I would tell all women they should have an established primary care provider, and that's someone who really at least has a complete database on you that you can go back and check in with. Telemedicine in those circumstances with that provider, depending on where we are in the COVID pandemic or what the particular situation is, may be a great adjunct to providing care.
And I wanted to interrupt you with the word adjunct. It's not instead of.
Right.
That in-person visit has to be there somewhere along the way.
That's right. So I think it's very different if you have an annual visit with your primary care provider who reviews your family history and your medications and has the ability to examine you and really knows you well, and then you have a UTI or a sinus infection and you're at work and you can't get away. That may be an appropriate thing where quality metrics are all the same and we're not worried about a delay in diagnosis. But the individual single visit care with a prescription prescribed, again, I think we've run very fast down this adoption of technology, and we just don't have any data to make sure that we are not harming patients by delay in diagnosis, misdiagnosis, interaction with medications. We just don't know yet. And again, I think, for consumers listening, just midlife women and beyond, I think having a primary care provider, someone who you see on a regular basis, is really important, and that the telemedicine may be an adjunct, but as a standalone, be cautious.
Thank you so much.